Good morning, ladies and gentlemen. This is Asha Shehi from the National Insurance Company Dhaman, and I am part of the disease management team. Thank you for joining us today in our webinar, Understanding Kidney Disease. Kidney disease is a growing health concern that affects millions of people around the world, without clear symptoms in its early stages. Raising awareness and understanding can help people take simple steps to protect their health and support those living with this condition. Please join me in welcoming our speaker, Dr. Wael, consultant nephrologist at NMC. Dr. Wael brings over 19 years of experience in comprehensive kidney care and has a strong background in teaching and training. He also is an active researcher with more than 14 published studies. Please note that you can send your questions through the Q&A chat box anytime during the session, and we will allocate 15 minutes at the end to answer these questions. Dr. Wael, welcome. The floor is yours.
Thank you, Aisha, for the nice introduction, and thank you for Daman for allowing me and giving me the opportunity to shed some light on this important and touching subject of chronic kidney disease, which is an epidemic. In fact, all over the world, we are facing this issue increasingly, and we encounter many cases, increasing number of cases of patients coming to the hospital because of chronic kidney disease. So I will be discussing on the following slides on the function of the kidney, what the kidney is supposed to do for our health, the major causes of kidney damage that we might be facing in our life, how the chronic kidney disease present in the general population, the major issues that can be related to having diseased kidney, and then we will shed some light on the pivotal underlying reasons for the deterioration of kidney function, and then lastly we'll discuss the preventive measures and the treatment policies that we have to adopt in our daily life in order to minimize the impact of chronic kidney disease on our daily living. So we'll start with the first slide. Yeah. So what is the kidney? Kidney is this organ. We have one set of two kidneys in our body. It is basically dealing with waste disposition, and it is functioning 24/7 without any interruption to maintain our internal environment to be even, without any toxins or any byproduct of the daily living that might interfere with our health. So it is basically two kidneys, and we have one artery in each kidney and one vein, and the size of the kidney is almost 10 to 12 centimeter, and it is growing. We born with a kidney small, and it is growing, and it depends on the birth weight. So the people who are born with prematurely, they usually have suboptimal kidney size, and their health might be affected. So the kidney is basically formed of we have the cortex, and we have medulla, and we have calyces that's collecting the filtrate, which is later on developed to urine. This is the photo of the kidney and how it is seen by the ultrasound and by CT scan. We can see here we have two kidneys shown, and we have two layers in the kidney, which is the cortex and the medulla, and these dark dots we call them the pyramids, which are packed tubules. And usually the cortex is the functional unit, and the medulla, the white inner side, is the collecting system. So just to have an idea about the anatomy of the kidney. So what is usually how the kidney is functioning? The blood is coming to the kidney, and the functional unit of the kidney, we call it nephron. Nephron is the microfilter. Microfilter, we can see here, it is just like depicted as this small ball inside the kidney. Each one of the kidney containing 0.5 to 1 million nephrons. This nephron is receiving the blood from the artery, and under certain level of pressure, it's releasing the water and the waste, going down to form the urine, which is usually passed to the urinary bladder. The kidney is a smart organ. It is not letting excretion of the important and vital materials like the ions, like vitamins, like protein. It is only secreting the waste that is accumulated because of our daily activities. They are also regulating the fluids and means water. So when the body is in need for water, the kidney will reabsorb most of the water excreted in the tubules. So top kidney functions. Kidney is not only a function of, it is only excreting the waste, but in fact it is having several other impact on the body. So apart from fluid balance, that's regulated by regulating body water and electrolytes, especially the sodium and potassium. They are regulating. They are having a pivotal function on blood pressure regulation, which is maintained by regulating the sodium and water volume in the body, and regulating the potassium as well. One important function which might be missed, or it is not famous, or not, it is not, I think no one is aware of. The kidney is the master of red blood cell production. So the kidney is secreting a hormone that is stimulating the bone marrow to produce red blood cells. So when the kidney function is down, the patient will be having anemia, will develop anemia. Some people will come to us complaining of anemia, and by digging and investigating, we would discover that this patient is having chronic kidney disease. The other important function, which is not shown here, the kidney is activating the vitamin D. So when we are taking vitamin D orally by supplement or production from the skin by interacting with ultraviolet light, this vitamin D will be only efficient and effective after the activation by the kidney. So when the kidney is not functioning well and not activating the vitamin D, then the patient might be developing bone disease like osteoporosis. So some people are coming with bone fracture or weak bones, and this might be a presentation of a chronic kidney disease. That's why some of the presentations are non-specific to the kidneys, and non-specific to the kidneys, and it is only by investigating by a nephrologist, a kidney specialist, then it will be it will be discovered that the patient is having non-specific presentation of chronic kidney disease. What is this nephron? Nephron, as we said, is the functional. Just in brief, it is the functional unit of the kidney, in which it is just like a sieve. We can see it here, just like a sieve. This is a ball containing tuft of blood vessels and receiving blood from the renal artery. When under certain pressure, this filter will allow the filtration of water and certain amount of electrolytes and other products. So when this filtrate is formed with these molecules, then the kidney is mastering the reabsorption of this filtrate. The kidney usually reabsorb the essential vital products like the electrolytes, the sodium, the potassium, the calcium, the magnesium, and allowing only the waste to be excreted. So under high pressure in that one, the filter, the sieve or the filtration barrier is formed of 3 layers, and after that the filtrate is formed. Usually the kidney is forming around 180 liters per day. 180 liters filtered via the kidney to be excreted in the tubules, and then the kidney will modify this 180. It would reabsorb the water, the essential elements, and excrete the waste. So out of 180 liters formed by this nephrons, almost the volume of urine is 2 to 3 liters only. So this is the function of the kidney, filtering this huge volume of filtrate, then excreting only 1%, almost 1% of this filtrate, less than 1%, almost 1%. 180 liters, then out of 180 liters, 2 to 3 liters will be excreted as urine. This is the glory of the kidney. So this is the glomerulus, and this is what we said. This is the functional unit, and what we call glomerular filtration rate is the. I want to just to keep this one in your mind, because in most of the times you will find it when you are going to the hospital, and under the kidney function test you will find this term, glomerular filtration rate, or GFR. So what is the GFR? GFR is the rate, glomerular filtration rate. How much is the filtration rate? How much the kidney is filtering per minute, which is usually, as we said, on one day it will be 180 liter per day, and in 1 minute it will be 90 plus ml per minute. So the chronic kidney disease is a common disease all over the world. With variable distribution. It is more in developing countries, less in developed countries, and in fact, the chronic kidney disease in the rise because of rising incidence and the prevalence of certain diseases that was not in this volume, particularly the diabetes. Because of the rise of incidence of diabetes, we are facing a big volume of chronic kidney disease, because diabetes and then secondly the hypertension, both of them are the major causes of chronic kidney disease. So the prevalence of chronic kidney disease all over the world is almost 14.2% of the population, affecting nearly 800 million people all over the world. which is a huge number of people. And this is pandemic. In fact, it is more prevalent than many other diseases. And as we said, it is mainly because of the rise of diabetes and because of the rise of hypertension. We can see here in this graph that North Africa and Middle East, we are Middle Eastern, by the way, we have the highest incidence of chronic kidney disease, which is almost 18% of the population. Again, this is because of the high incidence and the prevalence of diabetes in our region. Because of the development of the management strategies and the new therapies, the people with diabetes are living longer. By living longer, then the complications related to diabetes will be more prominent, especially the chronic kidney disease. So other common causes of chronic kidney disease, as we said, diabetes is the leading cause, then coming the hypertension, and then glomerulonephritis. Glomerulonephritis is the inflammation of the nephrons. You remember we said the nephron is the functional unit of the kidney. So glomerulonephritis is a complicated term just to explain the inflammation of the nephron. So glomerulonephritis is one of the leading causes of the chronic kidney disease. Then coming some genetic diseases, which is, again, it is high in our region because of related marriage. That's why we have more incidence and more prevalence of genetically determined kidney diseases like polycystic kidney disease. The other one is long-term urinary tract obstruction, especially by prostate in men, and kidney stone disease. This is another reason for chronic kidney disease. Then coming in relation to the obstruction, recurrent kidney infections, we call it pyelonephritis. Pyelonephritis is the inflammation of the pelvis of the kidney and the tissue of pelvis and the tissue proper of the kidney. So then we have some autoimmune diseases that is related to our immune system when it is misprogrammed to attack self. So the kidney is one of the field for this autoimmune diseases, and one of the famous diseases is the lupus or systemic lupus erythematosus. We put it last, but I think it has to be maybe second or third, which is usually missed cause of chronic kidney disease. That is certain medications and toxins we are usually consuming persistently over the years. That is especially the painkillers, we call it non-steroidal anti-inflammatory drugs, and certain other toxins like which is usually related to some industrial fields like lead and mercury that on long run can deposit in the kidney and causing damage with chronic kidney disease. So what is why the patient with diabetes and hypertension and blah 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 are having chronic kidney disease? So just to explain it in brief, in diabetes, because of excess sugar, this excess sugar damage the nephron. We will discuss it later in detail. Hypertension, high blood pressure will transmit it to the nephron and causing this damage. The family history and genetics, again, it is causing the derangement of the function and structure of the kidney, leading to loss of the function gradually. One of the important causes that we missed in the previous slide is the obesity. We are in a pandemic of obesity nowadays, and it is linked to chronic kidney disease. This is very important. As we said, medications, toxins, and painkillers, they are important causes of chronic kidney disease. The risk factors for chronic kidney disease: age over 60. This is a risk factor by itself. Any patient with heart disease is a risk factor for chronic kidney disease. And we have a syndrome, we call it cardiorenal syndrome. Cardio means heart related and renal kidney related. So they are both brother and sister. When the heart is affected, the kidney will be secondly affected also. That's why whenever the patient is having heart disease, we always investigate for chronic kidney disease. Then, as we said, autoimmune disorders like lupus. So in hypertension, just to focus more, because they are the most important causes here for the chronic kidney disease. So what is happening in hypertension? When the blood pressure is high, there is a barotrauma to the nephron and the cells in the nephron. So when the blood pressure is high, this high blood pressure will be transmitted to the nephrons, damaging the specialized cells in the kidney, causing damage, and then it will the blood vessels will be narrowed, and the kidney function will deteriorate. Similarly, in diabetes, due to high blood sugar and high tissue concentration of sugar, there is production of, we call it a glycation product, because the glucose is attached to certain materials, causing this material to be deposited in the kidneys, triggering inflammation and causing a problem. Beside some other pathway for activation of inflammation, leading to fibrosis and chronic kidney disease. So in diabetes, what are the steps and the consequences of having uncontrolled diabetes? Uncontrolled diabetes is the most important cause for chronic kidney disease. So when we have uncontrolled diabetes, this will lead to chronic, we call it hyperglycemia, high blood sugar, and this will lead to hyperfiltration, and this will lead to activation of certain mechanism inside the nephrons, and then metabolic alteration consequent to high blood glucose, leading to inflammation. Most important part in this slide is the clinical progression and outcome. So when the patient is in the first stage or early stage of what we call diabetic nephropathy means the kidney disease secondary to long-term diabetes mellitus, type 1 or type 2. Usually type 1 after many years can develop after 10 to 15 years can develop chronic kidney disease. But in type 2, the patient might have diabetic nephropathy or chronic kidney disease right from the day of diagnosing diabetes mellitus type 2. So the first presentation or the first sign that the patient is developing diabetic nephropathy is the presence of microalbuminuria. What's the meaning of microalbuminuria? Is the presence of minor or small volume of protein in the urine. This is microalbuminuria. Albumin is kind of protein that is pivotal for our body function, and the kidney normally is not allowing this protein to be excreted. But then when the kidney got damaged by diabetes, because of this high pressure and high filtration that is depicted here, so this albumin start leaking in small volume in the urine. That's why when the patient with diabetes is visiting us, the first thing we are doing as an investigation is urine for protein or urine for microalbumin. So the first stage, when the microalbumin is positive, means the kidney is affected. Of course, we are not depending on one sample. Usually we are doing it over 6 months, repeating it 3 times. So when it is persistent over 6 months, then this is a stage of microalbuminuria, diabetic nephropathy. And the good news here is that this stage is reversible. It is a red flag when the albumin is there in the urine, and which means we have to be strict in controlling the diabetes, controlling the blood pressure, and of course using particular kind of antihypertensive, which is medicine for blood pressure. At the same time, it is reversing diabetic nephropathy. So at this stage, it is reversible. Usually, if we are not too late, we can revive the kidney and we can prevent the progression of progression to the next stage of diabetic nephropathy. If the patient is missed and he is not taking the proper medicine, he is not following up with his diabetologist or his nephrologist, then this stage might progress to overt proteinuria, where when the kidney is excreting increasing amount of protein in the urine. So when at this stage, usually we need to be more aggressive. We need to combine more medicine. In the first stage, usually one medicine is enough, but at this stage, more medicine to be added. We have to be strict in controlling diabetes. With hemoglobin A1C must be around 6.5, and the blood pressure must be around 120/75. So this is with the use of combined medicine, we might be able to control the disease at this stage 2 of overt proteinuria of diabetic nephropathy. The other parameter that we are usually monitoring is the EGFR. We explained EGFR earlier. So EGFR is the parameter that express the filtration rate. Filtration rate is the function of the kidney. So if the disease is progressing, usually the EGFR in the first stage, when the microalbumin at the stage of microalbuminuria, usually GFR is high. The GFR normally is above 90 ml per minute. In stage 1, when microalbuminuria is there, GFR usually more than 120 because of hyperfiltration related to high glucose and changes in the kidney related to the high blood glucose. But with the progression of disease and the increasing volume of protein leaking in the urine, then the GFR start to be decreasing because the kidney start to express damage to the nephrons, damage to the microfilters of the kidney, and the capacity of the kidney to do the filtration is decreasing. So then after that, it's coming when the GFR is decreasing further, reaching ultimately to chronic kidney disease if there is no treatment to halt the process, the damaging process of diabetes. Some of the patients, they are not compliant, unfortunately, and they are not taking medications properly. Of course, at this stage of kidney disease, combination of medications, multidisciplinary team management, controlling hypertension, controlling diabetes, controlling the body weight, and controlling the other risk factors like heart disease and hyperlipidemia, high cholesterol, all are interfering and all under focus to prevent the deterioration to chronic, to end-stage kidney disease. So we have what about hypertension? Similarly, the hypertension is causing, first of all, it will be having albumin to creatinine ratio increased because of the development of what we call hypertensive kidney disease, where the high blood pressure is damaging the kidney, leading to proteinuria, then structural changes in the kidney because of high blood pressure, and high blood pressure causing barotrauma to the vital parts of the kidney, in between brackets, the glomeruli or the nephrons, leading to sclerosis and fibrosis of them. Fibrosis means the vital organs converted to a scar. A scar means it is non-functioning tissue because of the damage and the progression of the damage. So the blood pressure is damaging the blood vessels in the kidney, damaging the nephron, and damaging the tubules of the kidney as well. And similarly, it usually presented with albumin, rise in the albumin to creatinine ratio, and later on deterioration of eGFR. That's why blood pressure control is really the key here to prevent a disastrous outcome of uncontrolled blood pressure. So, why the kidney is progressing to chronic kidney disease? It's okay. We understood that because of diabetes and because of hypertension as major causes of chronic kidney disease, some damage is happening there. So after this damage, why the kidney is progressing to end-stage kidney disease? This is because there is an adaptive hyperfiltration in the remaining kidney. So when there is a damage in the kidney, initially, the kidney is overworking to compensate for that damage. And this overworking kidney, on short term, it is fruitful because it is compensating for the damage. But on long run, this hyperfiltration, overcompensation, is leading to tear and wear phenomena of the kidney and further damage to the remaining residual kidney tissue. That's why after a while, and once the patient was on for a while without treatment for high blood pressure, his kidney got damaged. Then he got this blood pressure under control, but the severity of damage is significant in the way that the rest of the kidney is overworking to compensate, but this overworking is detrimental for the remaining tissue of the kidney. That's why it is always mandatory to follow up closely that any patient with a chronic kidney disease, any risk factor for chronic disease, we have to follow him regularly for the detection of protein in the urine and the GFR drop. So this busy slide just to show that even the initial damage that is controlled later might be leading ultimately to chronic kidney disease and kidney failure. So what are the complications of a chronic kidney disease? As we said from the previous slides, the kidney is having varied aspects of function related to different aspects like the blood pressure monitoring, blood pressure control, the production of active vitamin D, excretion of toxins, stimulation of bone marrow to produce to produce the red blood cells. That's why when the kidney is failing in chronic kidney disease, we will be having like fracture of the bone, because the bone will be weak because of the lack of active vitamin D, which we said that it is activated by the kidney. So in chronic kidney disease, there is no active vitamin D in the body. And the supplement the general people are using, like vitamin D, Euro D, or D4 injection or oral, it is useless. We can't say it is useless, but it is less effective, significantly less effective than with the kind of vitamin D that we as a kidney doctors prescribing to overcome this problem. So bone disease is a remarkable feature of chronic kidney disease. Some people are coming with a fracture, and we discovered that they have chronic kidney disease. Because of that, their bones are thin, their cortex of the bone is thinner, and after trivial trauma, the bone is fractured. So this is one of the features that we have to underline. The other problem that is linked to the kidney, and we said we call it cardiorenal syndrome. When the kidney is diseased, the heart will be diseased. There is a strong bond between the kidney and the heart. The volume regulation that is mastered by the kidney is usually affecting the heart. So when the volume is not well controlled, then the heart will be affected, and some people will be developing heart disease or heart failure because of high volume status in the body. This is one. Secondly, because of some intrinsic factors that is manipulated by the kidney, the heart can be affected significantly, and by having this effect, it might be developing coronary heart disease and heart muscle disease because of the kidney function. That's why whenever we are diagnosing a patient with a chronic kidney disease, we are assessing the heart. Next step will be assessing the heart status. This is very important. Third part is the nerve damage. Because of the accumulation of toxins that is usually excreted by the normal kidney, these toxins are accumulated in the blood, accumulated in our body. The kidney is unable to excrete that one. Some of the toxins are causing damage to the nerves, peripheral nerves, or even the brain itself. That's why some people are coming with abnormal sensation or altered sensation in the periphery, like absence of sensation or vague sensation or pain. We call it pins and needles. So this is a feature of a chronic kidney disease related. We call it peripheral neuropathy or peripheral neuritis. Peripheral neuritis means the inflammation of nerves in the legs and hands and arms because of the accumulation of toxins in the kidney, accumulation of toxins in the body, leading to damage in the nerves. So some people are coming with this manifestation. Some people are coming with acutely or emergently with what we call foot drop. Foot drop means the patient is not able to raise his foot, and we call it a dropped foot. So this is sometimes because of advanced chronic kidney disease affecting the nerves, and this is an indication to initiate dialysis or to go for kidney transplantation. The other one is the buildup of swelling in the leg. Buildup of swelling in the leg. This is because of inability of the kidney to excrete the excess water. So when the water is accumulated in the body and the patient is unable to excrete the extra water, then this water will accumulate in the legs, in the thighs, in the tummy, and most importantly in the lungs. So the patient might be coming with air hunger. He's not able to breathe, just like he's drowning. And as we said with the heart, this can lead to heart failure. So heart failure plus the accumulation of fluid in the body will lead to what we call pulmonary edema or accumulation of fluid in the lungs. This is an emergency again, and usually this is an indication to start dialysis and to get rid of this extra water. The bones, we discuss about the bones. Then the blood pressure. Sometimes high blood pressure or hypertension might be secondary to kidney failure or chronic kidney disease. Primarily, the patient is without hypertension, but after developing chronic kidney disease, blood pressure is usually high, and the patient is hypertensive. This is because of several factors. In fact, one of them we mentioned, few of them we mentioned already, like the volume status. When the patient is, we call it hypervolemic, or he's having too much water in his body, in his blood vessels, then this will be increasing the blood volume and causing high blood pressure. High blood pressure consequently will affect the heart, leading to heart disease and heart failure, and high blood pressure will affect consequently the kidney, damaging the kidney further. So it is a vicious cycle, in fact, and it is interconnected between the kidney, the heart, and the blood vessels and the water. The second reason for the high blood pressure is the inability of the kidney to master the sodium. Sodium is an important ion in our body. It is maintaining the integrity of cells by controlling the water transfer between the inside of the cells and outside of the cells. So when this sodium is not handled properly by the kidney, it will be accumulated, and by doing so, it will raise the volume of the blood, and this volume of blood, as we said, will cause high blood pressure, and high blood pressure, heart failure, and then water in the lung. So this is water in the lung, water in the body, water in the legs. So some people are coming with complaining that they have their legs swollen for the last month, for the last few weeks. And when we investigate and when we examine the patient, we discover that this patient is having chronic kidney disease. And consequent to his chronic kidney disease, he's having swelling in the accumulation of fluid, and his legs are swollen. Important function, other important, which we hinted at, is the anemia. As we said, the kidney is secreting a hormone that is pivotal for the production of red blood cells. So when the kidney is failing, this hormone is no more in action, because there is no more production of this hormone. And this hormone is stimulating the bone marrow. So when it is diminishing, it is no more there, then the kidney, then the patient will develop anemia. We call this hormone erythropoietin. So when erythropoietin is missing, there is no more production of red blood cells, and the patient will be feeling all the complication of anemia, like lethargic, like weakness, like he's not feeling well, he's feeling cold, he's less productive, he's having impotence. Many things related to symptoms of anemia. So anemia, as part of chronic kidney disease, it is shouldering significant symptoms and signs caused stemmed from chronic kidney disease. So chronic kidney disease leading to anemia, leading to many other manifestations related to anemia. So any patient with anemia, especially we call it normochromic normocytic, this is special type of anemia. It is not because of iron deficiency, it is not because of something else, but because of lack of this hormone production. We call it anemia of a chronic kidney disease. Many patients will be coming with this anemia, and sometimes they might be misdiagnosed, and they might be treated with iron supplementation, with multivitamins, even sometimes with blood transfusion. But the main cause of anemia is not iron deficiency or because of vitamins deficiency, but it is because of the lack of erythropoietin that is pivotal in controlling the anemia. So anemia as a presentation is a clue for the investigation of a chronic kidney disease. So it is master hemoglobin production. Bone disease, as we said, because of deficiency of vitamin D. So this is an important issue actually, because some people will be misdiagnosed as a case of osteoporosis. Osteoporosis usually related to aging or related to medicine, most related to aging, in particularly in females after menopause. So osteoporosis in most of the times it is age related, which has special pathway for treatment. But in patients with a chronic kidney disease, it is not the osteoporosis, the known osteoporosis, the age-related osteoporosis. It is chronic kidney disease related osteoporosis. The treatment is different. So it is not the usual treatment of osteoporosis, because nowadays people are aware of osteoporosis and the need to take anti-resorptive therapy, that is, they are taking every 6 months, and in order to halt the process of osteoporosis. But in kidney disease, it is little twisted. It is not, because it is not the same mechanism that is causing osteoporosis. It is related to chronic kidney disease. So the management of osteoporosis in chronic kidney disease has to be involved, the nephrologist or the kidney specialist must be involved in this management, because it is not, the treatment is not the same. It is not the same at all. Yeah. So as we said, the symptoms, in advanced stage, features of chronic kidney disease in advanced stage, we can have the itchiness of the skin, again, because of the swelling of the ankles. We might have reproductive issues. The patient's usually infertile or impotent, poor appetite, nausea and vomiting, especially early morning, and frequent urination because of the high urea and high creatinine. The blood pressure is high, brain fogging, the brain is not clear. All these symptoms, we call it uremia. This is an advanced stage. Of course, we have 5 stages of chronic kidney disease. We might be missing earlier. Stage 1 is when the GFR, we call GFR, glomerular filtration rate, is 90 plus. So when patient presented with protein in the urine, as if you remember in that slide with diabetic stage 1, we said GFR is more than 120. This is, we call it stage 1 chronic kidney disease, more than 90. It is chronic kidney disease because of the high GFR and because of the presence of protein in the urine. Stage 2, when the GFR is dropping from 90, between 90 and 60, this is stage 2. Stage 2 is the GFR is decreasing, and Usually the patient is asymptomatic. Then stage 3 is between 60 and 30 glomerular filtration rate, ml per minute. And usually we are dividing it into two steps, step A and step B, 60 to 45 and from 45 to 30. Usually the patient is developing symptoms of chronic kidney disease at this stage, usually stage B, below 45. The high blood pressure, the anemia, neuropathy, these things will be handling of water might be impaired a bit. This is in the stage 3. Then stage 4, when it is dropping below 30, between 30 and 15. Below 30 and 15, the patients start to develop prominent anemia, fatigue, blood pressure uncontrolled, loss of appetite. Then stage 5, which is, we call it end stage kidney disease, when the GFR is below 15. GFR below 15 means it is less than 15 ml per minute. The kidney is filtering less than 15 milliliter per minute. This is very poor kidney function, and the patient will show all the features depicted in this cartoon, like the itchiness of the skin, swollen legs, frequent urination, fogging of the brain, poor sleep, altered pattern of sleep, metallic taste, then nausea and vomiting. Nausea is very, very prominent at this stage, in fact. And sometimes persistent or reluctant nausea and vomiting is an indication to start dialysis. Usually we are starting the dialysis in stage 5. Stage 5 below 15, but in practice we are starting it when it is below 7 or 8 sometimes, depend on the symptoms. So when symptoms are there and it is persistent, not alleviated by conservative measures, then we have to go for dialysis at this stage. Unfortunately, it is irreversible. Sometimes partially reversible by adjusting the medications, but even this partial improvement would improve the longevity of the kidney and keeping the patient at bay without prominent symptoms. But usually it will be there for a while. Ultimately, the patient will be in need for renal replacement, or we call it kidney replacement, either dialysis or kidney transplantation. Yeah, so strategies for, this is the most important slide. How we prevent chronic kidney disease. We divide this one into two steps or two parts: lifestyle modification and medical management monitoring. So lifestyle modification, as we said, healthy diet, low salt. We discussed about sodium retention. So low salt means low sodium. This will help immensely in improving the control of fluid status and blood pressure. So this is very important. And protein is a factor that is sometimes it is missed in this context, because protein, when some people are consuming too much protein, then this protein might be adding damage to the kidney. So we always advise them to reduce the protein intake and to keep it in the range of 0.8 gram per kg per day. When it is in this range, then the damaging effect of protein is less. So reducing the salt to less than 2.4 grams per day, sodium, and reducing the protein to less than 0.8 gram per kg per day, and increasing the fiber to enhance satiety of the patient. Regular physical activity like 150 minutes per week, aerobic and strength. This will strengthen the muscles, strengthen the bones, and it will enhance the health status of the heart and improve the vascular tree of the body. So it is important really at this stage. Weight management, weight is very important because weight is another burden on the kidney. It is causing hyperfiltration, just like what the diabetes is doing. If you remember the slides earlier. So when the kidneys, when the patient is obese, this will add more burden on the kidney, which is already on the brink. So weight reduction is really important, and it is helpful to enhance the kidney function and prevent further deterioration of chronic kidney disease. Usually the normal BMI is 18.5 to 24.9. This is our target. Other things like quitting smoking and alcohol, definitely this will be helpful a lot to prevent the stiffening of the arteries, and this will enhance the kidney health. The important issue here is the regular checkup. Certain people are at higher risk of developing chronic kidney disease. As we said, the diabetics, the patients with heart failure, hypertensive patients, patients with autoimmune diseases, patients with obesity, all those patients are at risk of a chronic kidney disease. That's why they are advised to visit a kidney doctor at least once or twice a year to frequently observe their risk factors and the impact on the kidney. So we are checking both sides of the equation: the risk factors, the hypertension control, the diabetes control, the body weight control, the other diseases control like polycystic kidney, this genetic kidney disease, and then monitoring the impact on the kidney. Is the kidney badly impacted or it is not? So that's why regular monitoring is important. Then the medical management, blood pressure control is very important. As we said, we need to have it below 1. We need to have the optimal blood pressure of 120/70 or 75, and to have hemoglobin A1C below 7%. Cholesterol must be controlled, and regular checkup, as we said. Then avoid nephrotoxic drugs. Nephrotoxics means the medicine that is toxic to the kidney, like what we said, the hemoglobin, like the non-steroidal anti-inflammatory drugs and the painkillers. So this is in a brief to less than 2.3 grams per day, and then quit smoking. It is the same. Yeah, and here glucose monitoring, as with this is same lifestyle modification, then medication, then regular monitoring, fluid and electrolytes. In advanced stage, we must take care of the volume of fluid that we are taking, and to reduce in addition to reducing the sodium, we have to reduce potassium, because potassium again is one of the ions that is mastered by the kidney. So when the kidney is in a chronic kidney disease, then this ion will be elevated and is dangerous. So one of the issues that we are facing is what we call hyperkalemia. Hyperkalemia is high blood potassium. High blood potassium is usually dangerous to the heart and dangerous to the muscles, because it is causing cardiac arrest, God forbid, and it can cause even paralysis of the muscles. So it is very important, particularly in patients who is on certain kinds of anti-hypertension medicine that we are usually using in patients with a chronic kidney disease. So potassium is very important. I just wanted to highlight in this slide. So keep your kidney happy. I think this is the last, active and fit. Manage your levels of blood pressure and sugar, low salt, stay hydrated. This is very important. Particularly we are in Ramadan, the holy month of Ramadan. So stay hydrated always and get regular checks. Thank you very much.
Thank you, Dr. Wael, for the informative presentation on understanding kidney disease. We will now move on to our question and answer Q&A session. So, Doctor, to begin with, we have our first question. Can kidney function improve from one stage to an earlier stage, or is CKD always progressive?
This is a very good question. Thank you for that. It is basically depend on the cause of the chronic kidney disease. So as we said, if the patient is having stage 1 diabetic nephropathy because of diabetes and the patient is passing, we discover that the patient is having albumin in the urine and the sugar is out of control, blood pressure is out of control, then this stage is reversible. So by controlling the blood pressure and using special type of antihypertensive, we can reverse this stage to normal. In fact, even sometimes not only that stage, even little more advanced stages can be reversed. Of course, less chance to be reversed, but it is there. We can reverse sometimes by optimizing the medications and the cooperation of the patient. Yeah, so it is we can reverse sometimes back to normal.
Thank you, Doctor, for answering that. And we have our next question. Is high protein diet harmful to the kidney?
This is a very good question. Actually, we often face this question. Yeah. So if the kidney is diseased, like the patient is diabetic with protein in the urine, so taking high protein is definitely damaging. But if the kidney function is normal, kidney function normal means GFR is more than 90, no protein in the urine, no red blood cells in the urine. By ultrasound, both kidneys are there with normal texture, normal size, then no harm of the protein at all.
Good. And moving on, Doctor, what about painkillers? Is it really damaging for the kidneys?
Yes, one of the important causes of chronic kidney disease is what we call non-steroidal anti-inflammatory drugs, like Brufen, Voltaren, Volfast, all this group, Celebrex, all these things are damaging to the kidney because it is interfering with the filtration and integrity of the kidney function. So on long run, it is damaging. Sometimes after one tablet, we have patients who presented with acute or short-term deterioration of kidney function because of one injection. This is different story, but in long run, when some people are using it daily, then there is a high risk. In fact, yeah. Paracetamol is different. It is okay, not damaging somehow. Yeah.
And Doctor, what about recurrent UTIs? How can this affect the kidney function on the long run?
Recurrent UTI, when it is associated like with a blockage in the passage of the urine, like in patient with prostate, big size prostate causing obstruction. This obstruction is sometimes leading to infection. Usually the infection in this situation is severe and causing damage to the kidney. Otherwise, recurrent infection of the kidney sometimes can lead to scar tissue, damaging the normal tissue of the kidney, leading to development of inflammation and ultimately scar. So by going down this pathway, the patient might be having chronic kidney disease. In fact, this issue is more prominent in pediatric age when the kidney is still growing. So when the kidney is still growing and is getting infection, the impact will be manifold. Actually, it will be severe, causing progressive damage in the kidney, and the kidney will stop growing. So some people are coming with small size kidney, and the other is normal size. This is because of early life infection. Yeah.
And Doctor, moving to our last question, are there any common myths and understandings about kidney disease that the public should stop believe?
Myth in the actually some of the this is a good question. Some of the people, they have strong belief in herbs. They believe that herbs can revive the kidney function and can improve the chronic kidney disease, increasing the urine output, empowering the health of the kidney. All these things are myth. In fact, it is not proved scientifically, and sometimes it's harmful. So whenever you are facing this issue and you want to be sure that this pathway is okay to go on with, or it is harmful, listen to your doctor always. Consult your doctor for any issue related to your kidneys. Yeah, I think this is what I remember now. Yeah.
Sure. With that, Doctor, we will wrap up the Q&A session. Thank you once again, Dr. Wael, for sharing your expertise and valuable insights on such important topics.
Thank you.
And to our audience, we have now reached the end of our webinar. Thank you for joining us and participating. Please take a moment to answer the survey questions. Your feedback and inputs are appreciated. Thank you again for joining us, and we look forward to seeing you all again at our upcoming webinars. Stay safe.